Okay. Hi, I'm Marissa Nicoloro. This is my abdominal assessment video.
I consent to being recorded.
Okay. My patient consents to be recorded. And then this is the room we're in. There's no scripts anywhere, anything, or on the floor. Okay. So now we're just going to get started. So I would apply my hand hygiene before I walk into the room. Hi, my name's Marissa. I'm going to be your student nurse today. Before we get started, can I have your date of birth?
August 22nd, 2001.
Okay, perfect. So I'm just going to do a quick abdominal assessment on you. But I was just wondering, do you have any allergies?
No.
Okay, great. And if you have any questions throughout, just let me know. Okay. So first thing I'm going to do is inspection. So I'm just going to have you lay down on the table here on this side. So what I would be inspecting for is if the stomach is, the contour, if it's even. So I would get down on the patient's level. The stomach looks flat. It's not concaved or protruding or scaphoid. Then I would also assess the skin, make sure the skin is it's evenly colored. There's no scars, tattoos, piercings, anything like that you want to be made aware of. I would also assess the demeanor of the patient. She looks relaxed at the moment. And then I would assess hair distribution, which seems evenly distributed. There's fine hairs, and I would also inspect the symmetry of the stomach, so it's symmetrical on both sides. So now I'm going to auscultate the bowel sounds. I would listen to the bowel sounds for 5 to 30 seconds. Unless I didn't hear anything, then I would listen for 5 minutes. So I'd start in the right lower quadrant, and I would use the diaphragm. There we go. All right, so I'm just going to feel in each in each quadrant of the stomach. So we start in the right lower quadrant. Okay, great. So everything sounds good. The sounds are high-pitched tinkling, so that's normal. So now I'm going to listen to the vascular sounds with the bell of my stethoscope and listen for any bruits of anything. So I would start with the femoral artery and work my way up. So I'm just going to listen to the vasculature stomach right now. So start with the femoral artery, then the iliac, then the renal. Then I would move centrally to the aorta, go back down to the renal, and iliac, and femoral again. All right, so everything sounds good. I don't hear any bruits or anything. So next I'm going to percuss the stomach, and I should hear tympany over every region of the stomach. So I'm starting the right lower quadrant here. I'm just going to percuss your stomach, your abdomen right now. So let me know if you feel any pain or anything when I hit my finger. You do feel any pain?
No.
No. Okay, good. All right, so everything sounded normal. Heard tympany when I was percussing. So now I'm going to do palpation. I'm going to start with light palpation. So I'm just going to feel around your abdomen. Let me know if you feel any pain when I do this. So start in the right lower quadrant, use 4 fingers and press down 1 to 2 centimeters. Feeling for any lumps or bumps, any masses. Do you feel any pain when I do this?
No.
Okay, good. All right, so next I'm going to do deep palpation. So I'm going to push down a little bit more, feel for the organs and the texture of them. So let me know if you feel any pain when I do this. All right. Any pain there?
No.
Okay, great. Let me know if you have any questions as well. All right, great. So I didn't feel anything abnormal there. Now I'm going to palpate for the liver. So what I'm going to do is stand right next to the patient here. I'm going to put my hands down under the costovertebral angle, and I'm just going to have you take a deep breath. And then when I palpate there, I can feel the border of the liver, so that's good. And did you feel any pain when I did that?
No.
Okay, great. So now we're gonna palpate for the spleen. You shouldn't be able to feel the spleen unless it's enlarged, but it's in the left upper quadrant right here. So I'm just gonna have you take another deep breath for me. And I don't feel the spleen right there, which is a good thing. So now I'm gonna palpate the kidneys. I'm just gonna put my hand under here and lift you up a little bit. And then I feel the kidneys right there. Do you feel any pain?
No.
Okay, good. So now I'm going to do it on the other side. All right, great. So now we're going to assess for rebound tenderness, which assesses peritoneal inflammation. So I'm just going to push down directly on your stomach, and when I release, let me know if you feel any pain. So I'm going to push down here. Do you feel any pain when I let go?
No.
Okay, good. Now I'm going to assess for the Murphy sign, which is... it assesses for cholecystitis, so I'm going to move up here to the liver. I'm going to feel right here, and then I'm going to ask the patient to take a deep breath, and when you release, let me know if you feel any pain. Do you feel any pain when you release your deep breath?
No.
Okay, good. So that's a negative Murphy sign. Now I'm going to perform the Iliopsoas test, which tests for appendicitis. So I'm just going to have you lift your right leg up for me and resist against my hands. Do you feel any pain when you do that?
No.
In your right lower quadrant?
No.
Okay, good. So there's no appendicitis there. So, so now I'm going to have you sit up, and I'm going to do costovertebral angle tenderness, which assesses if there's any kidney issues. So I would come down to the costovertebral angle, which is right here. Then I would make a fist, and let me know if when I hit my fist you feel any pain. Do you feel any pain when I do that?
No.
Okay, great. So we're all set here. Do you have any questions?
No.
Okay, I'll be right back in to check on you. Call us if you need us. We're never too busy. And you're all set with your assessment. So then I would leave the room, and I would do hand hygiene, and the abdominal assessment would be done.